My name is Amy Starling, and I'm a nurse practitioner student at Auburn University. Today, I'm going to provide you with a public service announcement to convey the importance and benefits of utilizing a nurse practitioner for your healthcare needs. So sit back, buckle up, and let's get this show on the road. Nurse practitioner! If there's something weird going around the neighborhood, who you gonna call? Nurse practitioner. If there's something weird and it don't look right, who you gonna call? Nurse practitioner. So, who are you gonna call? A nurse practitioner, obviously. So let me tell you about why you should choose a nurse practitioner. The role of the nurse practitioner was designed to bridge the gap experienced throughout the United States of America in rural and underserved areas. But that role has also evolved with changes in society and healthcare. Nurse practitioners have transitioned from solely practicing in rural areas to also practicing in urban and suburban areas. In the primary care setting, nurse practitioners assume holistic treatment of the patient, which ranges from managed care of the patient to treating chronic and acute conditions as well. Nurse practitioners also function in a variety of roles in healthcare. They may be seen as educators, leaders, counselors, researchers, mentors. Nurse practitioners are also have also evolved as the role of healthcare delivery has evolved. What does that mean? It means you might find nurse practitioners in minute clinics or urgent care centers, transitional care settings, or even community centers. Nurse practitioners are some of the most phenomenal deck plate leaders in healthcare because they meet the patients where they are. But the majority of nurse practitioners still practice in rural and underserved areas, treating Medicaid recipients and other vulnerable populations that might not have access to health care were it not for nurse practitioners. The United States of America is one of the greatest world leaders, yet health outcomes continually lag behind other nations. One of the most glaring issues dominating healthcare in the United States are the disparities experienced in vulnerable populations. What I mean by vulnerable populations is Americans in rural areas and Americans operating near or below the poverty line. Americans that live in rural areas frequently struggle with adequate access to primary care, resulting in a deficit in preventative care and poorly managed chronic conditions, both of which can lead to significant increases in healthcare costs. One of the most effective ways to improve the health of Americans is to establish equitable access to healthcare and reduce healthcare costs, which is best accomplished through expanding access to primary care and expanding the scope of nurse practitioners. And I know what you're thinking. You're thinking, I hear you. Nurse practitioners are important, but why should I bother choosing a nurse practitioner compared to a physician's assistant or a physician? I'm going to tell you why. Nurse practitioners are holistic practitioners. I know you're thinking, holistic, what does that mean? It means nurse practitioners look at the whole patient, your medical history from birth until now, your physical exam from head to toe. Holistic care is important because it addresses preventative medicine, which makes sure that preventable diseases are prevented as best as possible. This could include smoking cessation to prevent lung cancer, cervical screening to prevent cervical cancer, breast screening to prevent breast cancer, and colon screening to prevent colon cancer, among other guidelines dictated by the U.S. Preventative Services Task Force. Our job as nurse practitioners is to keep you healthy as long as possible. So, who are you going to call? Nurse practitioners are also invaluable educators. I know, you're thinking, why does it matter if my healthcare provider is a good educator? Well, my friend, knowledge is power. In 2014, the CDC took a sample of 136,000 patients, and they assessed how well patients were educated. Across all disciplines, nurse practitioner patients were more thoroughly educated than physician patients. Patients with more education about their chronic conditions are less likely to need emergent care, less likely to be hospitalized, and they have less outpatient visits. Like I said, knowledge is power. So, who are you going to call? Thirdly, 17 years ago, the National Institute of Health determined that nurse practitioners had comparable prescriptions, return consultations, and referrals compared to medical doctors. However, nurse practitioners had higher patient satisfaction,
longer patient visits, and higher quality of care. Yet, lawmakers still limit nurse practitioners' scope of practice in 29 states. Despite limited practice in 29 states, nurse practitioners continue to consistently provide high-quality care in all 50 states. So quality and satisfaction, who are you going to call? I'm going to leave you with 3 main takeaways. Number 1, nurse practitioners are holistic. They take care of all of you, head to toe and everything in between. Number 2, nurse practitioners are the best educators. They treat you well and give you knowledge you need to know better and do better. Lastly, family nurse practitioners have good or better quality of care and patient satisfaction. With that being said, I'm going to ask you one more time, who are you going to call?